Last week on Awkward Conversations, we saw the terrifying statistics of the fentanyl crisis that are sweeping the nation. But behind each statistic, there's a real family, real pain, and real loss. And today we will look at the faces of fentanyl. We'll hear about a mother's crusade to give meaning to her devastating loss, and to two dedicated men on the front lines, each fighting a heroic battle in their own way. These are stories of love, loss, and the relentless fight for awareness and change. Today's conversation isn't just awkward, it's difficult and painful, but absolutely necessary. Now, I know this is not what you've come to expect from us here at Awkward Conversations, and we promise that we will get back to our mission of providing you with tools and resources that you need to empower your kids to make smart choices. But for today, please stay with us, as it's critical that you understand that the fentanyl epidemic can affect any family, anywhere, at any time. Amy, thank you so much for joining me today. This is Amy McCarthy, my co-host.
Pleasure to be here.
Thank you so
much for having me back to be able to talk about this topic, especially putting real lives and real faces and honoring those who have been affected by this crisis. Today, we are honored to have Andrea Thomas with us. Andrea is the founder of Voices for Awareness, an organization dedicated to raising awareness about the dangers of fentanyl and other synthetic opioids. Andrea's journey began from a place of unimaginable pain, and she is now bravely turning her grief into action. She has become a powerful advocate, working tirelessly to prevent other families from experiencing the same heartbreak. Andrea, thank you for joining us and your incredible courage and dedication.
Thank you for having me.
Andrea, I would love to start by having you share your personal story and how it led to the founding of Voices for Awareness.
So in 2018, I lost my daughter Ashley to fentanyl poisoning. And in 2018, we didn't know about fentanyl. My daughter didn't know about it. My family didn't, and I didn't know anyone. We had never discussed this before. And on June 11th, at 7:21 in the morning, I received a phone call from Ashley's father telling me that she was gone and that she had taken something and died almost instantly. And I couldn't even believe it. I couldn't believe that Ashley had taken a pill and that would kill her. Didn't believe the story and went looking for my daughter, only to find out very soon afterwards that it was true, that somebody had given her something and she died. And through this process, we learned about fentanyl. That was the first day that I had ever heard the name fentanyl, and that it was illicit. What she was given was probably illicit. Ashley was a 32-year-old woman. We had open discussions about drugs and alcohol. She suffered from pancreatitis, which could be very painful. And her boyfriend gave her what looked like a prescription pill, neither of them knowing it was made with fentanyl and that it was counterfeit. And my daughter took a half of this pill, which would be the regular dosage of her medication that she would normally take, the pain medication that she would take. And like I said, it took her life instantly. She was a mother, a sister, and this is what's happening all over America right now, that we are losing people that are not aware that they're being given a counterfeit product, that it's deadly.
We've talked about how one pill can kill, and sometimes not even an entire pill can kill, and that's your story is absolutely heartbreaking, and also such a wake-up call to everyone who thinks that their family won't be affected by this because they don't have any active drug users or people in their family who have addiction issues. And I think what we're seeing more and more is that doesn't necessarily have to be the case. Now, Andrea, what is the primary mission of Voices for Awareness, and how has it evolved through the last several years?
After losing Ashley, I then began researching and finding out that there were so many people dying from illicit fentanyl and these counterfeit pills, and started Voices for Awareness, with our primary mission being to educate as many people as we could about the dangers of illicit fentanyl and these other emerging drugs. And since then, it's grown immensely. In Ashley's case, in 2018, she was, from my investigation, number 14 to die from one distributor in my small town. And DEA did a thorough investigation, and we knew that it was happening and no one was talking about it, and we needed to start talking about it. And that's how Voices for Awareness started.
Yeah, talking about it is the one thing that we just emphasize over and over again. And you had open discussions with your daughter, and she was an adult, and you thought it would be fine, and she took what would normally be the prescribed dose of her medication. And it's just terrifying that this is happening to families over and over again. What do you think is the most important message for parents and the public to understand right now about the dangers of fentanyl and some of these emerging drugs?
The most important to understand that it's in everything out on that's illicit, right? And these street drugs. Old drugs, you could have an addiction for 20 years and not die.
Right.
And now this is an instant death in many cases. You will take it and either die or become immediately addicted. So it's very important for everyone to know not to take anything that's not been prescribed to you by your doctor and purchased from a legitimate pharmacy. Many people don't know that most of the pharmacies we see online are not legal, and you don't know what is in the prescription that you're ordering. So it's very important that no one takes anything that's not been prescribed to them, and to have open conversations with young people. That goes a long way in starting the conversation and educating people.
The stakes just couldn't be higher at this stage in the game in terms of the possible risk of death from these substances.
Yeah. And again, like I always say, I am not a person who likes to fearmonger or spread stories that are blown out of proportion or aren't true. This is 100% true. It's affected my family, kids, my friends, kids. It's affecting everyone right now. So I think it just can't be stated enough that this is not an overstatement, that a half a pill, one pill can kill. That's all that it takes. The important thing to realize is that it used to be that families thought, nobody in my house is using drugs. My kids aren't using drugs. And that really doesn't matter anymore. It can be the first time.
Yeah, I think we know that opioid overdose deaths are quickly becoming one of the leading causes of deaths of young people in the 18 to 39 space, and even under 18. And we know that 65% of those young people were never diagnosed with a substance use condition. It sounds like people like Andrea's daughter, where this is not something that they had ever experienced,
right.
And yet they took one of these pills because they were in pain or because they were experimenting, and it had fatal consequences.
So that's what makes this drug so different, right? We're losing the unsuspecting, those that are experimenting, and people already using. So no one is immune to this.
Right.
And it does not matter which situation that they are in, which one of the three categories they fall in. No one should be dying from this. Our mission has evolved. We set out to just warn people, but over this time, we see the need for so much more because the crisis continues to grow. So now we work legislation. And we work with families that have been impacted by fentanyl to train them and give them fact-based material, minus any scare tactics like Jodie had mentioned. Mm-hmm. The truth is bad enough already. Right. We don't even have to. There's no need to add to this. Right. But we train families to go out and educate others. We work with schools, consult for businesses, because it can happen as easily in the workplace or anywhere that you are. So really to educate everyone, reach as many people as we can, and continue to find solutions within our communities and with anybody that can share their voice. Everyone can make a difference.
And we need all of us to be working together to protect lives and to save lives.
You're watching Awkward Conversations Season 4.
Saving lives means staying informed. Knowing the dangers of using fake prescription pills can help those you care about and keep our community safe. As a parent, educator, neighbor, or friend, we all play a role in building safe and healthy futures for ourselves and our loved ones. Do your part to take the first step today. Visit GetSmartAboutDrugs.com to access education, prevention, and treatment resources. Fake prescription pills laced with fentanyl are deadly. Be their protector. Be informed. Visit GetSmartAboutDrugs.com.
Welcome back to Awkward Conversations Season 4. And returning to the show is Dr. Gary Kirklis, who has joined us in previous seasons and who is on the front lines of the fentanyl crisis. He's a pediatrician whose office is a 40-foot mobile medical unit that travels to various homeless shelters in Phoenix, providing free medical care to families. And he is a spokesperson for the American Academy of Pediatrics. So thank you, Dr. Gary, for joining us today. Always a pleasure to have you here.
Thanks for having me again.
Yeah, absolutely. Now, Dr. Garrett, you're on the front lines and you truly see the faces of this epidemic daily. What are some of the most concerning trends that you're witnessing and seeing regarding the impact of fentanyl on families and children?
Fentanyl, unfortunately, is just ubiquitous in our society now. The price of it is so low that literally anyone can get their hands on it. It doesn't take much to find it, either on the streets or online, and it's available in a pill form. So if you think about, we're talking about the faces of fentanyl in the 70s, 80s, and 90s, if you were going to use an opioid, you probably would have used heroin, which would involve you using a needle to inject it. But now with fentanyl, it's a pill, and literally anyone can take a pill, right? We've all had to take pills in our lifetime for various things. Right. And so now that it's flooded the market, it's available to everyone, and it's just that much easier for someone to use this, either inadvertently or on purpose. And that really scares me, because as a pediatrician, there was a certain level of comfort knowing that the average pediatric patient is going to go and seek out a IV drug experience. But now that it's a pill, very easily could be passed out at a party, very easily could be found on the floor if you're a toddler. And we've had these occasions. We've had toddlers pick up their siblings or their parents' fentanyl pills. We've had teenagers at parties take a pill, thought it was perhaps ecstasy, and instead it's fentanyl.
Yeah, it really is terrifying. And again, I think the shift from what we used to think of as more typical drug use, like you were talking about 70s, 80s, 90s, it usually required you had to smoke something, inject something, and you really had to go procure it. Now it shows up on your feed. It shows up, you're scrolling, and it's, hey, it's right here. And I think that a lot of times, because you were saying you just pop a pill, it's like taking an Advil. You don't feel like you're taking drugs. You don't feel like you're doing something dangerous. You're doing something that you do all the time. You take vitamins, you take pills, it's no big deal. And so I think also the mental idea for young people, it seems less dangerous.
And it seems less dangerous too, because often you think that maybe you're taking a pill that might be prescribed. That again, maybe I've taken this pill before because I have had it prescribed, or my friend takes it and the doctor said it's okay. And then it's not okay because it's been made in this clandestine jungle lab where it's just completely unsafe.
Yeah. What are some of the specific health challenges and things that you're seeing in your patients?
Sometimes, some instances, my patients are dealing with traumas. Either they have a history of depression or anxiety, maybe they have a history of some physical or sexual abuse. And so they don't know how to deal with that, right? And what we would like for them would be to seek out a counselor, some behavioral health. But when you think about that, you'd have to approach your parents to do that and find a counselor and talk to them, a stranger, and talk about your traumas. And a lot of times kids are looking for a quick and easy fix. And for me, battling the biggest health challenge is keeping kids mentally healthy and not to look for substances to bury or cover that pain. And so that's the bigger issue, getting kids to not even begin substance use or fentanyl use. And then for my patients that are using fentanyl, I know that eventually they're going to take a pill that perhaps has too much fentanyl in it. We know that 2 milligrams is enough to cause an overdose. And just to give some perspective, 2 milligrams, if you had a penny, 2 milligrams would cover up the date. That's how potent fentanyl is. And so when you get a pill, you don't know if it's going to have half a milligram of fentanyl or 5 milligrams of fentanyl, 2 times the amount that would need to cause an overdose. So I worry about that. My patients that are using fentanyl, I don't know what pill they're going to get this time.
Right.
So trying to get them to use Narcan or have their friends use Narcan, because I know it's much as I advise them, hey, you need to seek out substance use counseling, I know that's not always easy because they're dealing with a very serious chemical addiction to a substance like fentanyl. Right. So having them carry Narcan is another health issue that comes along with me.
Dr. Gary's point, that's why it's so important to educate young people. If we can start getting this information out there, make it a more comfortable conversation, and reduce the stigma that's related to these issues, where people can understand that this can happen to everyone, just not a select group, that would go a long way in saving lives, and training them to use naloxone is a big part of that.
Yeah, this is something we can think of akin to having seatbelts installed in cars and people using sunscreen and all these different public health issues that have come up. We have been able to find solutions and promote those solutions, and lives have been saved as a result of those changes. Talking about fentanyl, talking about the risks, talking about how to keep people safe are necessary parts of what we need to be talking about as a society, and destigmatizing substance use for sure.
Starting that core foundation much earlier would go a very long way in educating students as they got older.
Absolutely. And to Dr. Gary's point, I think that we can't have a discussion about substance use or misuse without also having a discussion about mental health care, helping people to deal with substance misuse, to help them deal with some of the underlying issues that cause them to use substances in the first place. Like you said, finding mental health care isn't easy. It's expensive, it's sometimes inconvenient, it is hard to do, but there are a lot of places out there that will offer sliding scales, that will offer free community clinics that are in your area. So if you're looking for mental health care, if you're looking for mental health care for your children, there are places and resources out there. We will put some of those in the show notes as well.
Absolutely. Yeah, I think as a mental health practitioner, I personally know it can be so challenging to connect to support. And I think for families to know that it does take some tenacity. So I think using resources like the SAMHSA Help Locator and 988 as the National Crisis and Suicide Hotline when someone's in an immediate crisis, those are some starting places. And being able to Google, many states have behavioral health helplines now, and your child's school and their pediatrician, people like Dr. Gary, are wonderful resources in terms of making those connections. And of course, we will include all of those resources in the show notes.
Andrea, I know one of the things that Voices for Awareness does is really work on advocacy and legislation for awareness around fentanyl use.
About 3 years ago, we started a project called Project Facing Fentanyl through Voices for Awareness. And that was a project where we decided we wanted to bring all of the families together and building a coalition of sorts. Recently, we participated in the China Select hearing. That select committee investigated the fentanyl crisis and where these precursors are coming from and why. So Voices for Awareness through Project Facing Fentanyl was able to gather families from around the country to come in as a face to this crisis before that committee and before Americans. And there, the discussion was quite heavy. Things that we already knew as families because we researched this inside and out. But this committee was able to tell America the situation with the precursors coming in from China and about the tax incentives that are given for these precursors to be sold. There's over 3,000 pieces of legislation currently before the Senate. We need to focus on the legislation and enact laws that actually will bring solutions to the table. Mm-hmm. And we have a long ways to go. It's not moving as fast as we'd like. This is an urgent crisis, and so we need to do better. But everyone should be involved in legislation, or at least where help is needed.
It's such a beautiful way, too, for people to get involved who maybe can't make it to their state house or can't make it to Capitol Hill in Washington, D.C., but have access to maybe send a quick email or a quick letter, a phone call to their representatives to talk about this issue being so important to them and to the people in their communities.
Especially if you think that this issue doesn't affect you, because chances are it will.
Exactly. And there's important work out there that needs to be done. The social media crisis, that's a huge thing that we're looking at. We have a lot of young people that are going to these dangerous apps, and then they become dangerous, right? Because they can reach distributors right there with these menus of drugs. And young people aren't even looking for it in many cases. It's just there. It comes up in their feed. And so we need to look at those types of things, look at our mailing system with the de minimis loophole. These precursors and these drugs can be easily shipped in small packages and not checked. And so we have to look at all availability and all of the ways that these distributors have made this poison available.
And I know there's also Fentanyl Awareness Day.
Facing Fentanyl started with these families, bringing these families together. And in part, that was to recognize how many we've lost. Mm-hmm. And I know when we first started, somebody said to me, do we really need another day? We have so many days out there. We recognize so many issues. Yes, we do. We've lost hundreds of thousands of people to fentanyl poisoning. And most of America didn't even know that a few years ago. And so August 21st, which is National Fentanyl Prevention and Awareness Day, was started to memorialize many of the people that we lost. And then also to come together on that day as affected families to bring awareness to this from coast to coast. And we were blessed going in with this project because the DEA supported our families and helped us have a large voice. And so now, 3 years in, it's not just our families that are talking about this and sharing information on National Fentanyl Prevention and Awareness Day. It's all of our federal agencies out there sharing our message. And that's how easy it is. You can, like you said, make a simple phone call to your Senate office and say you're in support of fentanyl legislation or education in schools for this issue. Or you can just share it in a message on social media. It's very easy, or just tell another person. So there are a lot of things that we can do to share the message. And our team is out in New York, Times Square on August 21st, and we have a large press conference. We have our messaging on those big billboards and get that message out to about 40 million people in 20 minutes. Anything you can do to share the message, we would appreciate it. It can save a life.
Andrea, it was so wonderful to hear about the Faces of Fentanyl event, and I love how you're keeping the memory of so many of these loved ones alive through that event. I can't wait to participate this year on August 21st. I'd also like to bring into the conversation Kevin Collins, Senior Prevention Program Manager for DEA Community Outreach and Prevention Support. Kevin is at the forefront of the fentanyl epidemic, spotlighting the human stories behind this crisis. Welcome to the show, Kevin.
Thank you very much. I really appreciate the opportunity to be here.
Yeah, welcome to the show, Kevin. I know the DEA is doing just an incredible amount of outreach and community interventions, but can you share some of the current initiatives, Kevin, that the DEA is implementing to spotlight some of those human stories that we were talking about?
Sure. To really focus on are the Faces of Fentanyl exhibit. Really started a couple years back when families started sharing their stories, and their stories are so important to really remind us that this isn't just all about statistics. There's a human being and a family behind each statistic that we hear about. Sharing their stories in the pictures, and we started putting the pictures in the lobby of DEA headquarters. So as you come into DEA headquarters right now, you'll see thousands of pictures, all of whom were sent in by families who've lost a loved one to the opioid epidemic. And so we started that. And the reality is that we had so many people share pictures and the stories that we ran out of space in headquarters. And what we're working on right now is creating a virtual version of that exhibit that'll be coming online later this summer. So when people come in the headquarters, in addition to the physical pictures that they'll see, there will also be a kiosk which they'll be able to interact with and see and hear and see more of these pictures of the faces of those who have been lost. In addition, people anywhere in the country will be able to visit a website where they'll be able to interact with the exhibit virtually. The other thing that we're really proud of is our family summits. 2 years ago, we started with the first national family summit here at headquarters in Arlington, Virginia. And families came from across the country to connect with each other and also to receive resources from DEA that they could bring back to their communities. That grew, so we now have regional family summits in each of the 23 DEA field divisions. And what's really great about these is families come in, they learn from one another. Hopefully they learn from DEA. They also learn from experts that we're able to bring in. And we're able to hear the incredible work that families are doing, sharing their stories in schools, taking action to make naloxone more available, changing laws at the state and local level. All of that is really powerful. The stories that they're taking, their grief, they're taking the pain that they've experienced, and they're turning it into positive action to make their communities better. And we really appreciate that.
Now, Dr. Gary, what are some of the stories that you're seeing and some of the ways that fentanyl is not only disrupting users' lives, but how that ripple effect is going out?
Kind of the sad part of my work is getting those stories of former patients who are using, and then either they just had a pill that just had too much fentanyl that caused an overdose. Equally sad, we have stories where we'll have a child, maybe a toddler, and if toddlers, they put everything in their mouth. That's how they learn about their environment. And we've had cases, numerous cases, where a toddler picks up a fentanyl pill that either that their older sibling was using or that their parent was using. And when you're talking about fentanyl, which is 100 times stronger than morphine or 50 times stronger than heroin, you get a little body takes one of those pills, and even an adult, it would be enough to cause an overdose. It does have a ripple effect, and that's really the best way to say it, is that everyone that knew that person is going to have to experience that death. The parents, the older sibling, you might say that person was at fault, but we're dealing with an illness that's someone has a chemical dependency on something, and of course they're struggling, and then now that has caused a death in their own family. So yeah, it affects a lot of people, including caretakers, nurses, the police officers that arrive at the scene.
One thing we always also emphasize on this show is that we are not here to villainize anyone, obviously, with substance use issues. Having been there myself, we seek only to educate people, to create understanding, and to create more conversations. But because of that ripple effect, it's just, again, exponentially increasing with each overdose. And that's the heartbreaking part, is that it gets worse and worse because the trauma and the grief all sort of stacks on top of each other and builds and builds. And there are so many young people out there who are losing multiple friends. I know several parents who have lost, and I don't know that we quite know how to handle that level of grief. And I think that's something, again, tying it back to mental health and tying it back to these conversations and normalizing and destigmatizing the loss of someone that you love from an accidental overdose. We can share our grief, and Andrea, I applaud you for that, because having these conversations is exactly what needs to happen, because I know so often families are embarrassed or ashamed, and that's not at all going to be the way that we have conversations and create awareness. We really need to be out there talking about this, and I just applaud all of the work that all three of you are doing. Thank you so much for it.
I just want to encourage families, if this is something they have experienced, to seek out support from others who have gone through a similar experience, and also for people who haven't experienced this, to think about how can you support those in your community who are experiencing this in the same way that you would if they had a family member die of a heart attack or cancer or any other tragic way of losing somebody. Because
this is not anyone's fault. This is not bad parenting. This is not a terrible person. You're not alone. And we really want to emphasize that, because that loneliness continues this crisis. I would love to hear some final thoughts from Andrea and Kevin and Gary about how we can keep pushing forward awareness and what we can do to continue to keep this conversation at the forefront.
I think the most important thing is exactly what you said, is that people, the stigma should not stand in the way of people reaching out and providing support. Those who've lost a loved one to poisoning or overdose, if you know someone who's in that situation, reach out and provide that support to them. And also use this as an impetus to educate yourself, have conversations with your child of any age or anyone in your family. Ask how they're doing. A lot of people are struggling right now, and a lot of people are turning to substances to try to make themselves feel better. As people walk into DEA headquarters every day, they see those pictures, and it's a reminder and it's a motivator to keep doing the work that we're doing so that no family has to suffer that tragedy.
Dr. Gary?
If there's one thing I would say, is I would strongly urge parents to have a conversation with their children about fentanyl. It could be super simple. It could be done in the car. It could be just discussing fentanyl in general. It doesn't have to be any sort of interrogation, because this is so ubiquitous in our society, and it can happen to literally anyone, a grade schooler, a high schooler, doesn't matter your socioeconomic background. We have to have a lot of difficult conversations, and this has to be one of them. It's just we don't have a choice anymore.
I think Dr. Gary hit a nail on the head. There's no perfect time. As a parent, we always want to set everything up so that we can make it the best conversation and hit everything and make this perfect moment. Now, do it now. Mm-hmm. Many of us did not have that option. We didn't know about fentanyl. And we can't bring our children back. All of these families are out at the forefront talking about this because we want to save lives. We're warning you. Yeah. So have the conversation now. Understand this is very dangerous and available everywhere. It's easily accessible. And you don't have to go to the dark alley anymore. No. Your kids don't have to be in a place where they're around maybe bad actors or bad people. You can get this anywhere. It can be delivered right to your home. And this is a drug like no other drug we've ever seen before. And there are more coming. There are emerging drugs that are even worse, if you can imagine that. Absolutely. And so let's just talk about it. Yeah. Start talking about it.
Andrea, can you tell us a little bit more about how we can support your work?
Sure. You can go to voicesforawareness.com or facingfentanylnow.org and get facts there. Learn how to become involved and what you can do. Reach out to us. You can always email me at Andrea@voicesforawareness.com, and we can send you facts, information for presentations, and we can guide people that really want to delve into this and maybe do something in their community. We have affiliations and many ways to help, big and small. They all make a difference.
And we will be with you on August 21st in spirit, on the internet, in full force. Thank you so much.
Thank you. I appreciate you.
Education and empathy. I think those are two key things that we need in order to continue fighting this battle. And thank you much. All of the links that we've mentioned will be in the show notes if you're looking for resources. Thank you, Kevin, Dr. Gary, Andrea, incredible guests. And I am just so proud to be doing this work alongside of you and be able to come here with Amy McCarthy and all of these wonderful conversations that we've had. It's super important and we won't stop having them. Thank you so much. That's all for now. Tune in next week for more of Awkward Conversations Season 4. We are here talking about preventing drug misuse among college students, which is obviously a really critical issue to talk about, but is not something that you should wait until your kids are going to college to talk about.
Since, like you said, there are no parents around, a lot of people might have not experimented in high school, so then they feel like their freshman year is the time to try things that they hadn't done before.
I think one of the things we notice when students are arriving on campus is that excitement for this is all new and everybody is like me and I want to fit in, I want to make friends, I want to be popular, and I want to find my group quickly.
When I think about how soon and how early families are having conversations with their children about college in general these days, it's a wonderful opportunity to remind children that onset of substance use can also put them at risk for kind of being derailed from their path if college is the path that they're looking for.
We also want to take a look at the campus culture and the local area. What is it like? What is the area where the university or college is located? Are there lots of bars promoting drink specials? Are there cannabis dispensaries on every corner? That can tell you a little bit about the climate of an institution and its local area that you may not get on a tour.
Try to get an appointment with most likely the Student Affairs Office. That's who you want to talk to because that's a lot of times where the prevention activities and services fall under.
Resident assistants and resident directors are a huge component of mental health care on campuses, and especially if you're living on campus.
We've got some great perspectives here, and I think it all comes down to communication and communication.
Make sure to check out getsmartaboutdrugs.com. Parents, caregivers, you can find so many resources of great information there about how to talk to your kids and make these conversations a little less awkward. A huge thank you to the Elks DAP, which is the largest all-volunteer nationwide drug awareness program, and also a huge thanks to the DEA for their outreach program and for making this possible.
The views, information, or opinions expressed during the Awkward Conversation series are solely those of the individuals, speakers, commentators, experts, and/or hosts involved, and do not necessarily reflect nor represent those of the production, associates, or broadcaster, or any of its employees. Production is not responsible and does not verify for accuracy any of the information contained in the series available for viewing. The primary purpose of this series is to educate and inform. This series does not constitute medical or other professional advice or services. This series is available for private, non-commercial use only. The production, broadcaster, or its channel cannot be held accountable for all or any views expressed during this program.